whatever we used to do on papers has gone paperless. So over the years, we have created thousands of digitized records that basically are left for analysis and study. Basically, a typical patient-doctor interaction, the moment the patient is out, doctor doesn't look at those medical records at all. So what we tend to do at Enlightiks is, we visit those records on an automatic daily routine basis. We pull out insights about the patient, about the hospital, about the operations, the revenue, and so on and so forth. And we put it on a dashboard for perusal of all the leadership team members as well as doctors who are managing that patient. What it does is two things. One, it brings in operational efficiency into the system because you get to understand these records from an angle of transactions, on the most popular transaction, the most profitable transaction. On the other hand, you get to understand the patient problem in its entirety rather than the episodic care that we provide in India today. In India already we have around 1,650 hospitals that are signed up with us through our partners because our go-to-market approach is through the partners. In the US, we also are working with a lot of accountable care organizations. So some of our largest clients are based out of US. And in the India, we are now catching up the traction. So, but what we do in terms of these analytics are basically three things. We do number one from the clinical angle. So I'm a doctor, so I would probably talk about the clinical angle first. Number one, we do next disease prediction, which means that anyone like you or me, if we walk into a hospital without any disease or some small ailment like a pain or a small headache or a fever, we don't know where we stand in terms of our patient life cycle, in terms of what we are going to contract next. But once a machine has access to all of your past data, retrospective data, and the way you are today in your lifestyle or the way you're living, we can pretty much predict which is going to happen to you 5 years down the lane, 3 years down the lane, 1 year down the lane. So that is what we can predict today through Enlightiks, and we use this platform of ours called Querit to analyze and predict that. The second thing we do with a lot of precision is disease progression, which means that if I'm already a patient of diabetes and I need to know whether I'll develop ketoacidosis or foot ulcer or any kind of a kidney disease or renal failure or anything else which is a complication of diabetes, when would I contract that and how will my diabetes be managed over the years? So I can predict that today. The third thing we do is risk stratification, which happens at a population level. So if I have, say, 100,000 health records, I can look at that population and say, okay, 90% of these patients are high-risk patients. So ACOs, Accountable Care Organizations in the US, have been using these population-based risk stratification for a long time, and that's what we help them do. When we talk about hospitals in India, hospitals in India have HMIS implemented, and at least I would say some of the larger hospital HMIS is already in place. Where HMIS is not there, there are some electronic medical records. Otherwise, laboratory records and discharge summaries and stuff is digitized. Some form of digitization is definitely there. What we do at Enlightiks is something really crazy. We recreate the crime scene. What I mean by that is, we might not know anything about the patient because the patient doesn't have electronic medical records hosted in the hospital. But we will get to know when he was admitted last, what was his chief complaint, what was his laboratory records, what is his discharge summary, what was the medication on which he got discharged. Basis that I can at least profile a patient in a way that I get to know that, okay, this population belongs to this particular population cohort and would behave like the patients that pertaining to that particular cohort believe. So this is the way we basically risk stratify a patient into high, medium or low risk category. Hospitals don't have to do much. However, the more the records, the more intelligent the system is. So if they tomorrow start hosting an electronic medical record and start collecting longitudinal data of patient over the years, obviously it's more beneficial for me because my predictions become that much more accurate. But even if they don't do it, it's just fine, because predictive analytics can predict based on existing data to an extent as well. So less data or few data is not something which basically is a no-no for predictive analytics to happen. However, in certain areas, if a particular kind of data is not available, maybe we cannot predict that particular area. What will happen tomorrow is we will also get to understand what kind of patients respond to a particular kind of medication and treatment well. So the treatment and the medication become a part of a clinical pathway that is derived out of real world evidence from the records that already exist. Plus, you can move all of this to point of care from a population level, which is where it is. And third is, it will basically help payers or insurance companies to only pay for those drugs or pay for a particular kind of treatment that has performed well in a large variety of audience, rather than paying for every treatment which is available for a disease.